Called this computer. Okay, so the video is now recording. So I'll do my normal introduction as I do for the podcast, and then I'll introduce you. Make sure you're Rimi Statkus.
Yes.
Just making sure I say it the right way, because I have botched up many of name. I think when Patrick was on, I think it is certainly McEneaney, and I just stuffed it up so many times. So, okay, here's my intro. Hi, I'm Tyson Franklin, and welcome to this week's episode of the Podiatry Legends podcast. Podcast designed to help you feel, see, and think differently about the podiatry profession. With me today is an Aussie podiatrist who is now based in America. He studied podiatry in Australia, then he went over and studied podiatry in America. Very interesting story. It is Rimi Statkus. Rimi, how are you doing today?
Very well, thank you. Great to be here.
Yeah, thanks for coming on. And you work with a serial guest on the show, Patrick McEneaney, who has been on episode 48, 74, and episode 108. So he has an amazing business. What does he like to work with?
He's running like a headless chook. There's just always 10 things happening at once with him. It's very busy, but he's done very well for himself.
Yeah, well, when he first came on the podcast, he had 3 clinics. Then the next time he came on, I think he had 6 clinics or something like that. And then on the most recent one, it's like 8 clinics, 17 podiatrists. And he's done most of this during the whole COVID thing as well, which, was really interesting. But we're not here to talk about Patrick, because he'll probably be back on again at some stage just to tell me about the next 10 clinics he's bought. Okay, so you started podiatry in Australia. So obviously you're from Melbourne.
Yep. Yeah, I finished the course at Trobe University, and finishing my 4th year clinicals, I did some in Hobart and evolved from there. And they said, come back. And I did. And I stayed in Tassie, in Hobart, and in the north and northwest area. And all up, I was there for 6.5 years.
Oh, right. Okay. So did you do your placement in like work experience in Hobart?
My 4th year placement was there, and then having such a good experience there, I thought it would be a good experience as a new graduate coming out, because you're exposed to everything from a podiatry perspective, and it was a good support network with the people working there.
So what was it about? So obviously when you did your placement there, you enjoyed the people that you were placed with and you were doing the work experience with. You obviously liked the area, because I know like Hobart's cold. It's a cold place. So was it because of the area as well? Like, even though the job offered a lot of opportunity and obviously they did everything at their particular clinic, but was it the appeal of the area as well that made you want to stay there?
Definitely. Honestly, the first part was, the surroundings. I wanted to go there to check out. And I went for a 3rd year placement. And because that went so well, then I did my main placement in 4th year. And that was a month. So I had a really good experience to gauge and see exactly what it entailed.
It's a beautiful place. I have been down, I went down there many years ago, just around Hobart, spent about 10 days down there. And I went, what a gorgeous place, except it was cold. There was we left Cairns. I was in Cairns. It was 33 degrees when I left Cairns. I arrived in Hobart. This is summer. I arrived in Hobart. It was 13 degrees. And I've got off the plane wearing a pair of shorts and a T-shirt. Should have checked the weather before I left. That's before we all had smartphones.
Right.
So, it was a rude shock to me when I got there, but just gorgeous place. I can understand why people live there.
Oh, yeah. Gorgeous, and best seafood produce, dairy produce, everything, wine, everything, and just the playground. Like, you could be up Mount Wellington within 30 minutes.
Yeah.
So I loved my time there.
So what was the itch to decide to do the DPM program over in the United States? How did that, because I know a lot of, even when I finished in 88, there were podiatrists that we used to talk about, I wouldn't mind going to America and doing further study over there, but I didn't know anyone that actually did it. What was it that made you decide to take that plunge?
Further on, when I was working in the northwest area of Tasmania, so I was setting up a couple of clinics. I was working as a diabetes specialist podiatrist. So working between the hospital and the community health centre and that sort of subacute high risk population. So of course you come across, you know, all the infections and Charcot and everything else. And there's only so much you can do before you have to do surgical interventions. And so that was the next thing in terms of my scope of practice. I wanted to do the surgical side of things. My wife is from Toronto, so you know, this part of the world as well. So that's why it was a plus for both of us. I was able to increase my scope and then, you know, closer to her family as well.
And then off air, before I press record, you mentioned that you met your wife overseas when you were traveling.
Yes, I did a 3-month trip around Europe and North America, and a couple of Aussie friends living in Toronto said, come to this baseball weekend. So I did, and I met her in the outfield as it works out.
And then you brought her back home with you?
Yeah, well, she came for it was supposed to be a 3-week visit, and then I asked her to stay, and became 2.5 years.
Yeah, so your parents go, you bring back any souvenirs? You go, check this one out. And your dad's going, all right, you've done well. So because she's from Toronto, so going back over to that, the other side of the world, much easier to travel from. We were in Chicago to Toronto. It'd be pretty easy.
Well, it is now. Because I originally, when I came over to America, I went to the podiatry school in Arizona.
Okay. Was it with Dave Armstrong? Was he there?
So he was south. He was in Tucson at that time.
Oh, okay. Yeah.
And so we're in Phoenix, or in Glendale, Arizona.
Yeah, like I said before that, I love Arizona. I've been going to Tempe, Arizona for the last 7 years. And it's right next to the university there.
Yep.
So great place.
We're further north of there. And went to school in Arizona, went through the program there. And then my surgical residency was in Chicago. And so I did that through Rush. And as things sort of just evolved from there, and then I met Dr. McEneaney, and then now I'm working with him.
Yeah. So we'll go back a step because I interrupted. Was that itch, like, so your wife now, she came over to Australia, but then you had that itch to do the DPM program, or what sparked that off?
So initially it was because I was sort of missing that surgical component. That was the first thing that I wanted to do. Yeah. And so looking, you know, either in Australia and then of course the DPM program, and knowing that full scope, because that would open up all the opportunities across North America. Okay. And so that's why I decided to evolve through that path. And so then I had to sit the MCAT in Australia. So living in Tasmania, to fly over to Melbourne to sit that exam, and then go through the whole enrollment process through Skype.
And what's the MCAT? Just so, because I know people would have heard the term before, and whenever I've got a few students who are part of the Podiatry Business Owners Club that are set up on Facebook, and a lot of them mention the MCATs. So what is the MCATs, if nobody knows what that is?
It's the medical college admissions test that they do. Okay. So it's a standardized test across America that they do, and they use it to get into medical school. So for our DPM program, same as the MDs and DOs. Okay. So you did that. Obviously you passed it. Then you got to choose whichever school you wanted to go to, or how did you pick that particular one? So initially, as it worked out, with the school in Arizona, they were initially going to let me finish a little shorter with the program because of my clinical experience. Because I was going to ask that, what's it like being a qualified podiatrist here in Australia, having so many years work experience, and then having to go back and become a student again with other people who you would have far more experience? And there'd probably be some areas. Did they let you not have to do some subjects because of experience? So I tested out of biomechanics and everything else. So when we had like a full quarter of all that, I had to do all the exams beforehand. To get through that. But the first 2 years is pretty much the same as everyone else, because all the didactic stuff, because we do everything. So most of the schools in America are affiliated with MD or DO programs. So you follow the same path as the other medical students, and then we sort of branch off. So even end of first year, when our schools with the DOs, they went off for their summer break, we had an extra quarter of low extremity. So after we is that because if you decide you want to change your mind and do something else, you can switch? Somewhat. It's not as easy as that. You still have to sort of redo, but then you can test out of things.
Okay.
So it's still a long path.
So you did the test, you passed, you chose Arizona. What was the reason for choosing Arizona again?
Just because initially I was going to finish shorter because it's a 4-year program.
Yeah.
But then as things evolve through, because you need to, with all the certifications and everything else, you need to pass this exam to move to this step to do that. And so different timings of the year, because my clinical part in 3rd and 4th year was going to be compressed.
Okay.
But then, of course, so that came a lot easier with my experience. But then when you're looking towards, a residency, obviously surgical component is the main part of it. You want to be fully prepared for that, because it's competitive to get through to the programs that you want. So you want to be as prepared as possible for that.
Okay, so you got in the DPM program. So you had to do the DPM program first, then you had to go and do the surgical residency. That's what you did at Rush.
Correct, and that was a 3-year program.
Okay, is that the only time you do surgery? Is once you get in the residency, or are you doing surgery while you're at university as well? Are you touching on that at all?
Oh yeah. We had a lot of cadaver workshops. So we had, besides anatomy, when you dissect the whole body.
Yeah.
And then second time around, we dissected the lower extremity on top of that. And then, we're practicing surgical techniques all the way through. And then on all your rotations in the 3rd or 4th year, you're exposed to it all. And then, of course, in residency, then you're doing it.
Okay. So when you went to, did your residency in Chicago, Illinois, is that how you ended up where you are now working? Was that what made you want to stay in Chicago?
So a couple of reasons. So main one was, so obviously it's close to Toronto, where my wife's from.
Yeah.
So location wise, it works well. There's just a lot of opportunities, a big city, as well as, I got to meet a lot of people through that and through all the different connections. And so one of the hospitals we used to scrub cases at is where Dr. McEneaney was. And so things just evolved in that sort of context. And then working with his group, we get a lot of good experience with the whole facet, from pediatrics through the full spectrum. And of course, diabetic limb salvage and trauma and everything in between. So we get to see everything.
Okay. And I'll tell, just so if people want to go and check out the business, Northern Illinois Foot and Ankle Specialist is where you're working now. So he's got a number of clinics.
Mm-hmm.
Do you rotate to different clinics, or do you just work in one clinic and that's where you are most of the time?
Yeah, I'm spread through 3 clinics, as well as a wound center at one of the hospitals.
Okay.
And then I have a couple of days in surgery as well.
Okay. Now, so you've done all the study, you got qualified, did your residency. Were you able to just work straight away in America, or did you then have to, you got to get a green card, haven't you? So you can work, or are you like sponsored?
So visa is always a fun challenge to work through. But being as an Australian is actually a lot better compared to other countries trying to apply.
Okay. Well, how come?
Because going through, I had a student visa to begin with.
Yeah.
So I applied for that. So you usually have to go through interview processes and all that at a consulate. And then I went through like the professional working visa. And then thirdly now there's actually a specific Australians working in America visa.
Oh, okay.
So you hear about all these lotteries and everything else. It's a lot more challenging to get a working visa.
Yeah. But
then there's a separate subgroup for an Australian specific visa, professional visa, to work here.
That'd be cool.
Yeah.
So now that you're over there, and like you said, your wife's from that side of the world, do you think this is where you're going to spend the rest of your life, will be in the States? So I talk to you in 15 years time and you'll be going, how y'all doing? And you'll go, can I get some water?
Will I be rolling the R's?
Yeah, rolling the R's and newspaper.
Oh, my friends will be hating it right now hearing that. But yeah, no, we are really enjoying it here. Like I said, I'm getting really good experience, and I'm working towards, getting my certification for rear foot and ankle privileges and everything else. So yeah. I can do all that, but of course you have to be board certified. And so that's
the next step. So you've done your residency, then you work somewhere for a number of years, say like with Patrick, and then you apply to be board certified.
Yes.
Okay. So the path that you've gone on, if there was an Australian podiatrist listening to this now, or maybe a podiatrist from the UK or any other country, and they went, yeah, I want to become a surgeon, would you say the path that you've gone through, you would recommend it to other people?
It's now it's good to see, you know, sort of light end of the tunnel, but it's a long, challenging path.
Yeah.
So, and you pretty much have to do, because you have to do the 4 years, you know, maybe you can test out of certain things, but for the most part, you know, the medical training is a lot more advanced, obviously. So that's why that first year is the solid medical schooling like everyone else. And then clinical was, I guess, easier given my background, but you still have to, you know, clock up the time. And then residency is a slog. Like you work those long hours in the hospital and, you know, finish clinical, then surgery, go back to back. And, you know,
yeah,
you get a call in the middle of the night for a trauma case or something like that, you got to go. And, you know, is that for everyone? Well, if those people that want to do surgery, then yes. But it's a long haul.
What about financially? How did you cope financially? Where you had a pretty cushy job in Hobart, you were getting money down there, you're getting paid, so you gave that up to go and study for 4 years doing the DPM program.
Yep.
Financially, did you borrow money to go and do that, or you were just great at investing your money earlier on and you're all cashed up when you went over? Because I know that the financial component is always an aspect with anything like this.
Right. And that is, and it's sort of been a bit of both. And everyone knows that schooling in America is expensive.
Well, you always hear about the huge debt that students have when they graduate, a couple $100,000 that they've got to pay back later on.
Yeah. And it is. And, you know, people always talk about, you know, oh, do you get paid more over there or in Australia? But, you know, it's all sort of relative, because in America, you pay more for education and for health, but then you may get paid more. But then in Australia, well, we know, you know, what education and health is much cheaper. So end of the day, how much further you're ahead, it's, you know, it's kind of relative. It's, you know, people always talk about pros and cons of our system in Australia with, you know, the public and private system, but then, you know, the public system's a lot better in Australia.
Oh, yeah. Because I've got a lot of friends in America, who are podiatrists, and you hear them talking about insurances and just the medical system is so much more complicated. And then when I remember once we were on a pile of us on a bus, pile of podiatrists, and I said, and I had my wallet there for some reason. I opened it up, and for younger podiatrists listening to this, the wallets thing where you used to put your money in and cards and all that. Yeah, now it's all on your phone. But I opened up my wallet, and all of a sudden I pulled out my Medibank private card just to move it somewhere, and someone said, "What was that?" And I went, "Oh, it's my health fund card. Yeah, when I go to like a physio, the optometrist, I give them the card, they swipe it through, the insurance pays a certain amount, and then I just pay the balance there and then." And they went, like, straight away. I went, "Yeah, just tapped and it's done." And they went, "Bullshit. That's so you don't have to apply to the insurance company to try and get money back, and you don't know what you're going to get back, and the person may not be covered." No, if it's not covered, it won't go through on the card, and then they just pay the full amount.
Right.
And they would just go, "Are you listening to this?" They're all pointing to it. Is everyone hearing this? What's wrong with our system? So yeah, it's amazing how advanced America is in so many ways, and at the same time, very complicated.
Yeah, but also you remember logistically, America's 10 times the size.
Yeah.
It's like, I remember even banking back in the day, because in Australia, I never used checks.
In America, they still do it.
Oh yeah, a lot. I remember the first time I had to use a check, I'm like, am I doing this right? It's like, I've never done checks in my life.
Yeah, it's just weird. I know, because one time I was over there and someone said, "Oh, Tyson, can I buy one of your books off you?" I said, "Yeah." And next thing they pull out their checkbook. I said, "What are you doing with that?" "Oh, I'm going to write a check." I said, "Either give me cash or just take the book." I said, "Because to give me the check, what am I going to do with it?"
Right.
What am I supposed to do with that? And they went, oh, what about just buy some drinks at the bar?" I said, "That works fine."
Done.
Yeah, done deal. So yeah, it's amazing. They still use checks. So what's been, you did the course. What was the biggest challenge coming from Australia over to there? Already knowing that you were a podiatrist and you were qualified, was there anything you struggled with doing the course?
Well, like I said, going back to going from working full-time to full-time student and medical school, it's intense.
Yeah.
So it's sort of like going from 0 to 100. It's just a big change. So that was a big adjustment to begin with. And because, you're studying 7 days a week, and that's all it was that whole time. With schooling was just school the whole time. So it was a big adjustment in that regard, but you learn to get on with it. And then like even second year, I remember you don't sleep and it's all study, and then you just pick it up and you move on. I remember first year, it's like, results come out and you're checking every single mark, where did you sort of not get it right or anything like that. Whereas second year, it's just sort of like, yep, you're good, move on, or you miss one or two, you don't worry about it. You just move on to the next one because you got to worry about the exam tomorrow.
Yeah.
And it's in the middle of a normal week. It's not, finals week or anything like that. It's just one after the other. And it's like trying to drink from a fire hose. It's just,
so compared to studying in Australia is a breeze. Well, we have our 14-week semesters and then you have a big long break, and everyone just sort of just cruises through it.
Right.
Well, I know I cruised through. I thought university was fun.
I enjoyed my time at La Trobe.
Yeah.
Yeah.
So university in America, they're doing the DPM program. Like obviously it's still fun. You still would have fun and you make friends, but you're just saying it's just more intense and probably competitive too, because depending on how you do in the DPM program would determine, do some people not get a residency?
That was an issue. The last year or two that's evolved and they've opened up more programs, and there was a large portion that missed out. I remember going back when we were going through school where there was a shortage of residency programs and people did miss out.
So what happens to them?
You wait for like a second round to see if something comes through, or if you miss out again, then you have to wait a year.
And okay, so you could do the whole DPM program. You've passed everything. Yeah. And I mean, you just passed. So there was nothing flash about you.
Yeah.
You don't, and if you never get a residency offered to you, what happens?
Well, you can't do surgery
to
begin with. And then
can you still call yourself a podiatrist and work in a clinic without doing the surgical component?
I think that they could do a clinical path.
Yeah.
Just a straight clinical. But really, for the most part, everyone wants to finish residency to be able to do everything, because to be fully qualified, you need to complete a residency. To have like a full scope, because even, previously some people only did more of the forefoot surgeries, whereas now we do the whole forefoot and reconstructive rear foot ankle. So that's a consistent across the whole country that they have now. So there is the consistency across the whole board now, whereas before it used to be like 1 or 2 or 3 year programs.
Yeah.
But everything now is 3 years and everyone does the rear foot component.
Okay. So do you see yourself, like you're in Chicago now and you said, because it's closer to Toronto, you think that's where you will end up staying, or do you think you'll bring the skills that you have, come back to Australia?
Good question.
We should get your wife on.
Sure
Damn it. Should have got your wife on as well and have her in the background going,
right.
Just shaking her head going, no, that's not going to happen. Like I've never been to Chicago, so I can't, only ever seen it, TV, but it looks like it gets cold in winter.
Oh yeah.
Yeah. Look, I mean, it looks like it gets freezing cold in winter.
Well, already last night we got a first sprinkle of snow.
And it's still, wow. Yeah. It's early and it's still nowhere near Christmas yet.
No. So it's like we skipped a season and we're gone almost to winter. It just dropped like a week ago. We still had nice weather. It was still in the mid 20s.
Yeah.
AKA for Americans, it's 80. But
yeah. Yeah, I was going to ask when you said 20. I'm going, yeah, I suppose it was Celsius.
Yeah, right.
Not Fahrenheit. I'm Fahrenheit. It's still cold. It's extremely cold. So where do you see so has it, from thinking back to that person you were, which you'd probably be now 4 years, 5, 6, 7, and you've been at Chicago working now for a year. So it's like going back almost 8 or 9 years ago that you started this whole process.
Yeah.
looking back to that person who said, "This is what I'm going to do,"
Mm-hmm.
would you recommend it to other people?
I would, because now that I see the light at the end of the tunnel, because it's a long slog.
Yeah.
And, there's times through it where you question yourself. It's like, really, should I be doing this? Or it's just, and it's hard, and, it just challenges all the way through. But looking back at it now, like the opportunities that have come up, working autonomously and doing everything that I can in the OR, it's just so rewarding, and I'm happy of being able to do that. And you see these patients, especially after surgery, after the whole recovery process, and you see the difference you've made in their lives. Or even, that patient who's got gas gangrene, and it literally is either not just limb salvage, but saving a life, because it can turn so quick. It is very rewarding.
So if somebody was thinking about going through this path, the first thing they need to do is do the MCATs first. They've got to pass that first before they can do anything else anyway.
Yes.
So when you weighed up like if somebody now was, say they've been a podiatrist, work for a couple of years, and they're deciding between, do I do the MCATs, do the DPM program, or in Australia, I think it's the Masters of Surgery they do,
Mm-hmm.
and then Australian College of Surgical Podiatrists.
Mm-hmm.
I can't remember the exact name. There's probably some podiatric surgeons in Australia now who are just wanting to punch me in the throat. Sorry, Ozan, Rob Herman. I do apologize. Who have both been on here before. So where do you see yourself 10 years time? Where does Rimi see himself?
That is a very good question. It's just there's a lot of opportunities to evolve. Even now, like in the middle of, I'm picking up my clinic is super busy.
Yeah.
My surgeries are busy, and getting involved in research projects and everything else. It could go a number of different paths in that regard. And it's just, I've sort of just followed to see how it evolves out, because I had no idea I was going to end up in Chicago, because, I wasn't tied down. I remember my fourth year, for schooling, I had to do my monthly rotation clerkships at different hospitals.
Yeah.
So I drove, driving the whole year, I went from Chicago to Detroit, to Houston, to Brooklyn, to Long Island. So that's, half of America driving, almost a third of America driving on the weekend.
Yeah.
So it's, like 28-ish hours on a weekend driving between rotations. So I spread around and saw a whole bunch of things. And, you meet different people in different contexts, and like these things evolve. I hadn't planned to stay in Chicago, but I went to a really good residency program. I was really happy with it. And then just the next step sort of moves on from there. And then, I met Pat and everything else. And here we are now.
Yeah, I was going to say, how did you and Patrick meet?
So one of the hospitals that he does surgery at, we used to scrub up cases. We started coming there, and we met through there. And then some of his colleagues that work with him, and it just picked up from there. So I think really from about second year residency, when it was just evolving and meeting them, and then obviously looking for the next path forward, and just looking then at the next step, and then working with him, because like I said, we get to see everything. So my whole experience, even pediatric surgical cases through the whole spectrum, it's good for the next step to really pick up and grasp and grow your knowledge and skill set. And that's where we're at.
Yeah, he's such a nice guy. Like each time he's been on the podcast, I can just talk to him for hours, because he's just so easy to talk to, and he's just so he just cares about wanting to create a better business, but also he cares about the people that he works with. And you can just tell, and even talking to you, you can pick up that there's this mutual respect with you to him, but also from him to the people that he works with.
Totally. And that's why he's been so successful in growing everything. And, COVID's been an extremely difficult time.
Yeah.
But we stayed open the whole time. We were going all the way through. It's funny how it works at part of that stage. I think it was almost 2 months where they shut down elective surgeries. But then you had, so, everything dried up in the hospital, you think, but then you have all those other cases of when patients then do not come into the clinic or don't come to the hospital. And so that mild infection with the ulceration is now full-blown osteomyelitis. So you're dealing with all that complications. And so I remember some days I was in the OR 5 days a week. It's like crazy. Like it just ebbs and flows. So, yeah.
So how is the biomechanical aspect of the DPM program and, like, say, the residency? Is that, because when I've spoken to people in America, when I've gone over there and we've been at conferences and we might be talking about biomechanics, and it seems like for us in Australia, or I know for myself, I really paid attention when biomechanics was being taught, and it was something I really loved doing, and designing orthotics and making, fitting them, adjusting them, doing all that. And when I spoke to the guys in America, they were so very surgical orientated. When we're talking about biomechanics, it's sort of like we seem to be ahead of them in the biomechanics through our training compared to what they were doing with the DPM program.
And I agree with that, because it's a very surgical focus now, and through school to prepare for residency, because that's the big focus. Even though we go to clinics and everything else, but it's really to build up all your case numbers and everything else.
Yeah.
And after doing both, like you said, because I remember, back in Australia, I used to, make my own orthotics or modify my orthotics and everything else. Whereas, we've got a podiatrist in our clinic who does a lot of that for us.
Oh, right.
Mainly because we don't have time for that, just because we're busy with everything else. It's just evolved that way, I guess. But I don't want to say you forget about biomechanics, because with surgery, it plays such a significant part, because obviously you need to align things appropriately surgically. So
yeah,
it does play a significant part in that context, versus the orthotics, I think, was more of an art form in Australia.
Yeah, because I know when I've spoken to other people from the States, and they said there's been not conflict, but just some podiatrists have been out for a number of years, just questioning when they're doing the DPM program, could there be two sort of directions that they can go? They get to a certain point, they go, I want to go down the biomechanical route, and they don't do surgery at all. Right. And then the other ones that go, no, I want to be a surgeon, and they go and do the surgery, the residency, and they go down that pathway, but the others choose more of a biomechanical pathway. So I've heard a bit of discussion about that.
There is. And so that's why, and there are some people that, they do a residency because they pretty much have to be able to work their full scope and everything else. But then they may not want to do surgery. And because there are so many other avenues, and large part can be biomechanics and sports medicine and everything else. Like even, the regenerative medicine, that's a big part now that's come through. There's also fellowship programs. So even after you finish your 4 years of medical school, 3 years of residency, if you want to add another year of fellowship on top of that. Yeah. And so it can just perpetually keep going if you want, pretty much. So I had enough. I had great surgical training, and I was happy with where I was at. We have a fellowship program affiliated with us as well. And so they look to do the next step as well. They're doing a lot of research, but also then, if they're looking at, total ankles or, all that kind of stuff as well.
Well, you mentioned that you were doing some research yourself. What is it that you're doing the research on?
So
unless it's secret. You go, well, I can't tell you.
There's a couple of work in progress that can't go there just yet, but if it's looking at particular surgical constructs that we're looking at now, is one of the courses we're looking at, and we're looking at a grafts with another one, and so because wound care is a big field, like everywhere, for podiatry, so we got a facet between sort of surgical and non-surgical, but we do a lot surgically.
Okay, so before we wrap up, have you got a final tip for anybody that's listening to this right now? Could be an Australian podiatrist, could be an American podiatrist who's been working for 10, 15 years. It might be a bit crusty. Have you got a final tip to inspire everybody that is listening to this?
Well, I think any part of the whole journey where you're at, if you're a new grad or you've been in the field, And part of it was, in Chicago, I worked with the plethora of different attendings, different aspects through their professional career. And you look at the ones that, they continue perpetually keep learning. They want to pick up. And so, look at even people like Arman Kalikian. He's been 30 plus years in the field, and he keeps evolving. We can be very comfortable with where we're at. People like to be comfortable with what they know.
Yeah.
And may not want to be challenged. And so a lot of people are okay with that. But if you want to keep progressing and evolving, and you just better yourself, because I know going through this whole path, I have evolved so much professionally, not just personally, but professionally through the whole thing, and just challenging myself to learn so much more. And that just makes me a much better clinician and surgeon in the long term. And so it was hard to go from, after working for a few years, to adapt to medical school and go through all that and work through all that. So even if it's with the schooling or just to pick up new things, you just want to keep pushing yourself, and that's just going to make you much better professionally and personally. It's much more rewarding.
I think that's a great point. And I used to say that to everybody, people that worked with me. I would say to them, every week, try and learn something. By Friday, try and learn something that you didn't know Monday, whether it's a clinical skill or it's just an aspect of podiatry that you didn't know about. And if you can do that every week, then at the end of a year, there's 52 new things that you've learned that you didn't know beforehand. And if you keep doing that year after year after year, and I think that's part of, like Ray Kroc said, you're either green or growing, or you're ripe and rotting. And some people I know in their careers, and I've seen them, people that I graduated with, and since then, they graduated. And from that point onwards, I don't think their mind ever expanded beyond what they learned at university, and they become very boring, cynical. What's the word that I'm looking for? Yep, I lost it.
I know what you're saying, though. You're exactly right. And that's what I've really learned as well, is just because I'm perpetually evolving and learning, like it just makes you much more well-rounded as well.
Or bitter and twisted. That's what I was going to say. They become bitter and twisted because they see everybody else's success, and they go, "Oh, they must be doing something illegal. They must be breaking the rules to have success that they've got." And they don't realize, no, they just kept growing, and they kept reinventing themselves and learning new skills. They didn't just sit back and go, "Oh, I think I know everything. I don't need to expand my brain anymore." So yeah, bitter and twisted. That was the thing.
Yeah, I remember, going through residency as well. Some of my best experiences was when I was on my internal medicine rotation or general surgery, because fortunately for us, most of our cases, it's elective. Yeah. But then on general surgery, it's those really sort of high risk ICU patients. And, when you have your patient die on the table, it's a very humbling experience. It puts a lot of things in perspective for you. And fortunately, I don't have to see that too much in what I do, but all of these experiences has just sort of evolved me to sort of where I am now. And I don't want to become bitter, twisted, and jaded and cynical, but I want to keep going.
And that's it. And the people I know that have had very long careers in podiatry have usually been the same people that have just constantly been learning. They're always learning new things. It doesn't necessarily mean it just always has to be podiatry. It's just, it could be anything. They're just constantly challenging. It might be playing a musical instrument, but they're constantly just learning. They're enjoying life by learning new skills and challenging themselves constantly. They're not boring, bitter, and twisted. So Rimi, I want to thank you for coming on the Podiatry Legends podcast. You will eventually get a shirt headed your way.
Oh, nice.
That you can wear proudly, like the one that I'm wearing right now. So thank you very much for coming on.
My pleasure.
One sec, to stop the recording there, and I'll just end the video now. So everyone that's watching this on YouTube, thank you for tuning in.